Welcome in, everybody. Welcome. We're going to give folks a couple of minutes to join us, and then we'll go ahead and get started. We're really excited that folks are here to join us today. So looking forward to the conversation. So that number of participants is still ticking up right now. So we're going to give folks, I'm going to wait until that starts sort of settling down, and then we'll go ahead and get started. As folks enter, you'll find that you are on mute. So we're going to keep folks on mute, but really are going to encourage folks to ask questions using the Q&A chat option in your webinar. So you can ask questions and we'll be fielding those here. We'll have some time at the end of the conversation for some question and answer. So please, as we talk, as we go, put those questions in. Still ticking up on those participants, which is great, but I think we're gonna go ahead and get started since it's 3 after the hour here. Good afternoon, everybody. Good morning to some, possibly. Welcome to today's webinar. We're gonna be focused on going beyond temporary relief for families and exploring the lessons learned from the ARPA investments in families, including those specifically in the child care sector and the child tax credit. My name is Alex Citron, my pronouns are she, her, and I'm a senior associate here at CSSP, and I will be your facilitator for today's conversation. Again, as you've entered the room, you'll notice that you're on mute, but we would ask that folks, as you have questions, please put those in the Q&A. We're gonna have some time at the end of today's conversation, and we really wanna hear from you all. So we've got a busy hour planned today, so we're going to start with a short presentation from my colleague, CSSP policy analyst, Ellie Coverman, who's going to synthesize some of CSSP's own research findings from interviews with 45 parents of color about their experience with the CTC and child care investments. It's really important today that we're talking about both the CTC and childcare together. Oftentimes we have those in separate conversations, but we're really intentionally bringing those together here because families face a lot of challenges today and there's no silver bullet policy solution. So we're really talking about how these two investments work in tandem because parents need both. And together they begin to provide the kind of supports that we owe families. After Ellie talks a little bit about what we've learned through our CSSP research, we're going to shift to a roundtable discussion between Ellie and 4 experts in the field who are here with us today and have helped us on in this research project. I'm going to briefly introduce them now, but of course the short bios I'm going to read don't begin to underscore the important work that they do or the contributions they're making to the field, or to this work. So first we have Dr. Aisha Yandaro. She's the Chief Executive Officer of Springboard to Opportunities, which is located in Mississippi. It provides direct support to residents of affordable housing. Springboard is also home to the Magnolia Mothers Trust Fund, an initiative that provides low-income Black mothers in Jackson, Mississippi, $1,000 cash on a monthly basis, no strings attached, for 12 months straight. It's the first guaranteed income pilot that specifically targets extremely low-income families headed by a Black female living in affordable housing in the U.S. Aisha and her team gave us thoughtful advice as we began the project and helped field our survey. Anthony Queen is a father and a parent advocate, both in Michigan and across the country. He's the co-founder and active member of CSSP's Parent Leader Network, as well as a member of the group that developed the Manifesto for Race Equity and Parent Leadership in Early Childhood Systems. He continues to provide technical assistance to organizations to support sustained parent partnership and has presented at national conferences to parents across the country and to state legislators. Anthony was one of our interviewees in Michigan, and his story is featured in the Michigan Brief. Amy Cubbage is the president of the North Carolina Partnership for Children, leading Smart Start, North Carolina's comprehensive early childhood system. Smart Start is funded through a public-private partnership and consists of 75 local partnerships, working in all 100 North Carolina counties to advance a high-quality, comprehensive, accountable system of care and education for each child, beginning with a healthy birth. Amy and the team at the Partnership for Children helped us to field our survey. And finally, Davita Dawson is mother to a young daughter and a preschool teacher in Rockingham County, North Carolina. Davita serves on the board of directors of the Rockingham County Partnership for Children. She recently earned her associate's degree in early childhood development and is currently pursuing her bachelor's degree in early childhood development. Davita was one of our interviewees in North Carolina, and her story is featured in the North Carolina Brief. As I mentioned, we're going to save time at the end for Q&A, so please use the Q&A function in Zoom to start popping those questions in as they come up. And without further ado, I'm going to stop talking and I'm going to turn it over to Ellie, who has helped lead the child care and CTC research with parents and co-authored 3 of the recent briefs that break down the findings, which we're going to put in the chat so you'll be able to click on those links and have access to them. So Ellie, let me pass it over to you.
Awesome. Thank you, Alex. Let me share my screen quick. I've got some slides I want to share. So my name is Ellie Coverman, as Alex mentioned. I am a policy analyst with the Center. Can everybody see my screen okay? We're good? I'm a policy analyst with the Center for the Study of Social
Ellie,
Policy.
sorry, don't mean to interrupt. It's on the mode where we can see the slide next to it as well.
Okay, great flag. Let me see how to, okay. Is it still on that?
Now we can see your notes section.
Okay. All right. Hold on 1 minute. Okay, I've got it here. Now is it right?
You got it.
Okay.
Third time's the charm.
Thank you, friends. Thank you. So I've helped lead some of our research that we've done in the last year with families, learning really what was the impact of the American Rescue Plan's investments in families. So I want to get started. I also want to lead with the caveat that we cannot possibly go into every single finding that we found from that work today. There's just a lot that has come out from that. So I would urge everybody to please go check out the website as well. I'm super excited to share a little bit more about the research. So to give some background, in March 2021, right, the American Rescue Plan Act passed, making really historic investments in families. And we at CSSP were very excited when that happened. And we were specifically really interested in the combination of the childcare investments that really came out of, the historic legislation that was in response to the emergency of the pandemic. So we wanted to see how the childcare investments merged with the income support investments in the CTC expansion, and really how those worked together to support families, especially during this critical time where we're all in the pandemic. So the funding, the investments really included both funding in childcare for providers and for families through the stabilization grants and the CCDF funding, as well as an expansion of the child tax credit, which essentially increased the benefit, made it monthly, and sent it to parents further down the income spectrum by basically getting rid of that income threshold on the bottom part. So we really wanted to learn how that all worked together to support families during this time. And additionally, we wanted to look at that because too often, childcare investments and income security investments are really pitted against each other as an either or, but we know there's no one solution to the many challenges families face. So that's why we really wanted to think of them together. And we really wanted to speak primarily in our research to Black and Latinx and parents of color generally, because we know before the changes to the child tax credit, the temporary changes to the child tax credit, Black and Latinx parents were actually disproportionately excluded from the CTC because of those income thresholds that ARPA temporarily got rid of. And I'd add too, just for context, the child tax credit expansion expired in December 2021. So we're coming up now on 1 year since those investments. So that's a little bit of of what we wanted to understand, who we wanted to talk to. We also wanted to narrow in on a couple of different specific states to really get an idea of the different experiences families could be having. So we narrowed in on Michigan, Mississippi, North Carolina, and Arizona to conduct that research in, because they were geographically diverse and different demographics. So it stood out to us as a good 4 states to really dig in on how these investments were impacting families. And I also want to say this work was made possible through partnering with around 20 or so community-based organizations in those states. So, and I know many of them are on the call today. So again, thank you all so much for your work in this, in making this possible. This would not have been possible without your partnership in this. So we really appreciate that. So with knowing basically what the investments were, we knew we wanted to interview families, and we knew we wanted to conduct a pretty large survey to get data on both ends of how families were experiencing these investments. So we conducted 45 semi-structured interviews with low-income parents of color from across the country. And these looked like 75 to 90-minute, really pretty in-depth interviews about their experiences with the CTC and with childcare, and kind of gauging how families were doing as those investments went out. And families were compensated for their participation in those interviews. And then in addition to the family interviews, we did interviews with really stakeholders, and especially stakeholders in other parts of the state. So especially on childcare, we spoke with childcare providers, government officials, system leaders, really everybody who could give us a wider perspective of how the childcare investments specifically were rolled out in the states. And then finally, we wanted to field a survey to get a good sense of how families were, again, experiencing these investments from another data source. So really, our survey hit almost 2,000 respondents, which was incredible, and each of whom had at least one child under the age of 18 who lived with them. And 64% of the respondents identified as a person of color, most of whom were identified as Black. And 69% of the respondents had a household income of $50,000 a year, and 29% had a household income below $25,000. So that's a little bit more about who exactly was in our survey findings and what that means. After conducting the research, we basically went in, did all the analysis, and wrote up some draft findings. You can see here, these are the 3 briefs that we put out that are very state specific from those findings. I definitely encourage you all to go check them out. I think there'll be links dropping in the chat that will lead you to those as well. And we've also thought about ways that we can really think more about the broader findings. And so those are all available on our website as well. And there's more coming out every couple of months from us right now on this. So without further ado, I want to get into the actual findings, because that's why we're here. And again, there's no way I'm going to be able to get into everything today, but I'm excited to share some of what we found. So we'll start with the child tax credit. So we found in our survey and in the interviews, most of the families that we spoke with and surveyed had received the expanded child tax credit. In fact, it was 89% of our survey sample that received the child tax credit. And consistent with other surveys, Latinx and Hispanic respondents, as well as respondents with incomes below $25,000, were less likely to have received the expanded child tax credit, which is a really important finding when you think about, what the future could look like with the CTC and where improvements are needed. We were also really interested in learning what exactly did families spend those dollars on. And that was a big topic in our interviews with families, talking through what kinds of things they spent the money on. And from our data from the survey as well, we know that basic needs rose far and above as the number one ways that people use their child tax credit dollars. It was traditionally on groceries, rent, mortgage, utilities, those things that are really the basic building blocks of life to be able to thrive in that sense. And I will say too that we found in our survey data that Black families and low-income respondents were more likely to have used their CTC checks on basic needs, which is also, again, consistent with other national surveys. We found through the survey data, as well as through the interviews, that the checks really had a direct effect on overall stress and parents' and families' quality of life. In fact, 34% of respondents said that the CTC allowed them to buy more or higher quality food, and almost 30% said that it allowed them to secure stable housing. And that was much more pronounced among families who had incomes below $25,000. So we know that the child tax credit checks really went a long way in basically helping families make sure that they had the basics down. And then that in turn helped cover some of the stress and anxiety that went with making ends meet. And we also wanted to learn a little bit moving forward into the future, how does that look for what parents want? So we asked directly, if you were to receive a permanent cash payment for your children, how often would you want to receive it? And parents were clear that they would want to receive it at least monthly. And that was clear in the interviews as well as in the survey data, where 67% said monthly. So as you can see from Evan here, a father in Michigan, it really is that consistency that helps. You can throw the CTC in your budget and it takes the weight off of you. So you can see how that the function of it being consistent and monthly and regular really made a difference for families. And I will say too, with talking with families, there was a real anxiety and fear around the child tax credit ending, a sense of what are we going to do once it's over, and that sense definitely translated over into the childcare space as well, both for families and providers with the investments. So we'll go ahead and start talking a little bit about childcare now. So we found from the interviews that childcare was really difficult pre-pandemic. Families were really struggling to find affordable and quality childcare that fit their needs. Families reported to us and in the survey data that oftentimes they were quitting their jobs or reducing work hours just to cover their childcare needs. And you can see from this quote here from Caroline, a Michigan home-based provider, when the pandemic hit, the bottom really fell out for families, right? She says, I was paying out of my savings to care for other people's children. I think that's why so many providers just couldn't do it. You can't survive when you're working in negatives and working 60 to 70 hours a week and not being paid. So you can see the emergency really hit, right? And the American Rescue Plan investments kind of sought to stabilize that crisis and emergency for both childcare providers as well as families who needed childcare, right? And so for people who, the investments did make a difference for families and for childcare providers, for people who received the funding. It was a tangible way to help pay the bills, whether that's payroll, repairs, equipment, staff training. It went a long way in helping to shore up their businesses. And there was a real theme that came out around feeling like finally people are putting their money where their mouth is, and there's finally a newfound respect for really childcare providers and the work that is early childhood education. An important thing to highlight though with the childcare investments is because it was on the states to roll out that funding, it meant that every state did it slightly different. And because it was slightly different, that led to slightly different or sometimes very largely different outcomes, right? So we've really found that in some states, there were delays and state roadblocks that made the process much more difficult for the funding to get out and for it to actually give some relief to families and providers. And we really found that, trust and partnerships really matter in doing these sort of investments. And it matters who is at the decision-making table here, right? It needs to be stakeholders, providers, policymakers, all of them together to actually build trust and relationships to ensure that those investments go out in an equitable and fair way. And we saw in Michigan and North Carolina that stakeholders were really important partners for that outreach and really helped policy leaders reach a wider array of communities, including Smart Start, the Smart Start network in North Carolina really helped, bring together those communication channels and make it successful. But in other places, like for example, in Mississippi, there was more of a deep-seated lack of trust and partnership between childcare communities and the state agencies that run the funding, which made it much harder to implement the policies effectively. And that really led to providers feeling this chronic disrespect. And that then led into a fear that either they'd have to pay the money back or there'd be really strict scrutiny of them. And then they were less likely to apply for the grants. So overall, we really found that this trust and partnership is key to the childcare investments. And we also found that fears around the sustainability of those funds really permeate throughout both childcare providers and families. In fact, you can see here on the left here is a childcare provider who is saying, you know, like, what are we supposed to do now once this funding runs out, right? And on the other side, you can see Robin, a mom of 2 in Michigan, who is saying similarly the same thing about the income support, right? So you can see like the sense of nervousness of what happens after is true for both providers and families. And it's a huge thing that really came out of this research, and that the temporary investments did really genuinely go a long way to support families in the moment. But temporary is not enough to ensure that families and providers can thrive and can really move into the future. So that's it for me. But again, this was just a tiny taste of the research. I definitely recommend checking out the website, and I'm really excited for our conversation. Alex?
Great. Thanks so much, Ellie. And thank you for walking us through that information. Again, would definitely encourage folks to go to the briefs, go to the website to learn more. What Ellie shared obviously is very high level, but it's clear that these investments are important and that they matter. They matter to families now, and it's important for us to understand how we can make them even more effective moving forward. So we're going to get into conversation now with our esteemed panelists, and going to sort of take it in those sort of 2 areas, right? Really start by hearing about when these investments in the CTC and childcare became available. How did that shift for families? What difference did that make for families? What difference did that make for communities? And then we're going to shift into a conversation that's more forward thinking, right? What do families need moving forward? So I'm going to ask questions. I might direct them to one of the panelists, but again, would invite others to jump in, join in. This is really about a conversation between you all. So I'm going to start though with Anthony and Davida. And really want to know from you all to start, how did receiving the CTC between July and December of last year impact your families and communities? Did anything shift either in your families' lives and plans or in your communities when those funds ended in January of this year?
I definitely saw a shift in my household. That it was around the summertime, and we were able to receive the funds at a time where my daughter was beginning. I was in school, and my daughter was getting ready to transition into preschool, and that bonding time was important. So, along with having a boost in my security, knowing that she was getting ready to start preschool in a place that I was more comfortable with. So availability and better preschools became available, but I was also able to be more confident in myself and able in my ability to provide the type of things that she would need for that year coming up, whether it was a new pair of shoes or fitting shoes and clothes. And also that I also saw a shift in my community with just my neighbors, and how we were just excited just to even talk with each other outside and hear that, yeah, I wasn't late this month with paying this, or I was able to get this done and out the way. And in the school system as well, I remember there was one family in particular that was having car trouble, and it was beginning of the year, and they were saying that, yeah, I was able to use mine to fix, the car, so I didn't have to pull from this and from that. So I mean, even though it could be something as little as paying a bill on time, that's a boost. That's a big boost in a family's confidence, them knowing that, okay, I have this taken care of, so I won't have to worry about that. But that, and as Miss Ellie said, that stress level was definitely reduced with the extra money we received during those months.
And I would say for me, and this is real important, not even one overdraft notice, not a fee, but a notice. I never got one during that time. But it gave me, seriously though, it gave me and my community and a lot of parents who I interact with a sense of security. Like Davida was saying, to be able to pay a bill on time or even get in front of some bills and know like I'm not going to be sweating from paycheck to paycheck. It was just finally like, it was a whole different feeling. You know, to a lot of my community, it was like, they never had that feeling before. From the time they were like 10, understood bills and stuff in their household and in their homes, it was always a struggle to make it, to get there. And providing that extra food, meals for families, especially with the inflation and the price of groceries nowadays, that was something that, you know, it was just, it really hurt when it left. I'll put it like that. They really felt the effects. And one of the things that I always fought about and talked about with other people whom I'm associated with is they always talk about socialism. Whenever it's something that's going to benefit brown and black, it's socialism. But whenever it's an exclusive community, it's what's best for the United States and for their budget. So that went around a lot. And we talked about that a lot. But yeah, it was just that sense of like knowing that I have the security blanket for once in my life.
That's deep. And I appreciate both of you sharing your personal experiences and also about your community. You know, say these are small things, but it's a big deal and what that does for a person and for a community. So I appreciate you all sharing those perspectives. Aisha, you've been raising awareness and advocating for the importance of getting cash to families through the Magnolia Mothers Trust. Was what we saw with the CTC, that it was widely available, a helpful tool in keeping families afloat? Was this largely aligned with what you see in your work with families?
Yeah, no, thank you for that question. And, you know, you're exactly right, Alex. With the work that I do, I've been a cash advocate, not only through the Magnolia Mothers Trust, but in the larger community of guaranteed income advocacy and cash without restrictions advocacy since about 2017. And what we have seen in both the research that Ellie presented, as well as in the conversation with Anthony and Davida, is that when families get extra money, they go about the business of taking care of themselves and their families, point blank period. They pay the bills, they go out to eat, they're able to pay for food, they're able to have the breathing room and agency to make decisions for themselves that are aligned to the needs of their families. And Anthony is exactly right. We don't take that as a benefit when we're talking about brown and black communities. We take that as something extra. But when we are talking about that benefit, excuse me, the minority, it's something that's exciting that they actually have agency and choice. And so what it is that we've seen in our work for the last few years is exactly what it is that the child tax credit expansion manifested, is that families take care of themselves. And it's very interesting because it's countering that narrative that we have told ourselves for years as it relates to families in poverty, that when we give them extra money, that they no longer show up for work, that they go about doing things that are quote unquote nefarious. That's not true. That's a narrative that we are telling ourselves that it's a lie. And we actually need to divorce ourselves from that narrative. And those of us who are working in this space and those of us that have benefited from the child tax credit, we should be pushing folks to divorce themselves from that narrative, because it is doing all of us harm, not just the families that have benefited from it.
I really appreciate you bringing up the narrative piece. As you were talking, I was just thinking narrative change here and all this past damage imagery that we get when we talk about this in Black and brown communities, right? It's associated with this negativity, but exactly what you're saying from what the research and what we see and what we know is that this is a real positive benefit for families and communities. They take care of themselves and they do well. And you talked a little bit about anxiety, and Davida and Anthony, you talked about stress level. We know how important financial stability is for families' overarching health and well-being, right? So Ellie, can you talk a little bit about what the research has said about the child tax credit specifically in this instance, and families impacted by stress and anxiety?
Yeah, of course. I think that stress and anxiety piece is an under talked about piece of the child tax credit. It is so intuitive, right? When you can pay your bills, you're less stressed. When you can make sure your kids have dinner or a winter coat, you're less stressed about things. It makes a lot of sense. And I love what Aisha just said when she said breathing room, because the phrase breathing room came up so frequently in our interviews with families that it's such a physical feeling that stress and anxiety is in the body, right? It feels like you have more space to actually breathe, right? So the stress and anxiety piece is really, I think, a crucial part of the child tax credit research. In our survey, we asked basically a question: how did the CTC affect your daily life? Across all respondents, the number one answer was it helped reduce my financial stress. I think it's really important to pull out that among families with incomes under $25,000, 93% said that the number one way it affected their daily life was that it reduced their financial stress. 62% said that it helped reduce their stress and anxiety overall, not even just stress related to finances. And then another 49% said that it reduced the stress of their children. So it's a policy that helps the family as a whole, right? It's not just about one piece of it. It's the overall family well-being that helped with the child tax credit.
Thanks, Allie. And I really appreciate you highlighting both the impact for parents and for children. I think oftentimes we forget about that impact for both and really for the family as a collective whole. So as we mentioned at the top of the hour, we really want to talk about both the CTC and also around childcare, both of which are so critical and central to parents. I mean, Davida talked about it in your opening, right? You talked about your daughter starting preschool and having more options that you felt good about. So, I want to switch and talk a little bit about childcare now. And Amy, I want to go to you first around how did childcare providers you work with at Smart Start use the dollars that they got through the American Rescue Plan?
Thank you, Alex, and hello to everyone. We're so appreciative of your work at CSSP in doing this research. It's incredibly important. I'm honored to be with my colleagues from Mississippi and Michigan here and North Carolina representing Davida. I'm very proud to be with you as well. But we really saw childcare providers in the state of North Carolina, and I think in other states likewise, dive right in and follow the guidance on compensation, compensation, compensation. This workforce has been in a state of crisis far before the pandemic, and they have been underpaid for incredibly valuable work. Many economists argue the most important work we could be doing in America to further the country, to further democracy, is put it into paying the people who are caring for and educating our youngest children. That's powerful. And to finally see the federal government say, okay, we get it, maybe only for these couple years, but we see it. That's a bit of light at the end of a tunnel that has been so long for so many folks doing this work, to whom we are indebted as a country, as a nation. And it's, I am passionate about that, and passionate about saying those dollars went finally to those folks doing that work. And it went in terms of healthcare benefits, paid time off, things that many of us take for granted as being part of being in the workforce and being a professional. But the vast majority of folks in early childhood over the years historically have not had access to that, have to rely on public assistance and public programs that fortunately are available to some, but that also then, are questioned, and you're faced with lack of respect for having to utilize those programs as you do the very work and are told by all the research, the work you're doing is the most important. And the people we care about most across the political spectrum are babies and young children. And it just is astounding that it took this kind of historic pandemic and crisis to bring awareness to this field. But they stepped up, providers kept going, plowed through, utilized these funds to pay a living wage. The average is $12 an hour across the state of North Carolina. To boost that up, so important and very important not to roll back on that now. And also to improve classrooms. Children with disabilities who didn't have accessible classrooms, providers were able to purchase materials and furniture. Providers who provide essential after school and before school care for school-age child care were able to get furniture that's sized for children, not, our 0 to 5, outfit those classrooms. Those are some of the most impactful ways in which those dollars helped in North Carolina.
Thanks so much, Amy. And you said it better than I could, right? There's been this just historic, consistent underinvestment in, if you can even call it that, right? In early learning. And, Davida, you're a provider, right? You work in early learning and early education. And I'm interested from your perspective, what impact did you see in your day-to-day work from this infusion of federal resources? How did you see that impact your environment that you work in?
It was a dramatic impact. I mean, from new playground equipment. Sorry, I'm a little emotional, Ms. Covich, but that was astounding. Thank you for sharing that. But it was
thank you for all you do.
The increase in pay, the influx of materials. We didn't have to go in our pockets the past few years. We even had the summer program for children, and that to me helped a lot of children who we see in the community without a lot to do during the summer because their parents are working. And we were able to open the summer program. We were for the summer months. This past summer we couldn't because the funds were exhausted, but last summer we did. My second part-time job, she purchased, which she gave us raises in the increments as well throughout the year. She purchased bicycles, swing sets. It was just astounding. It was a very, very dramatic change that we saw, even in the children, and them knowing that we don't have to keep sharing the same materials. I can play and you can play at the same time. And with that, it's just the increase of morality, an increase of belonging, an increase of just knowing, having the basic necessities that people think are everywhere, but they aren't. And to finally, for children and for us as caretakers to have that but have more income, and to see the children happier and able to play with things that weren't accessible to them before, it gave us a boost in ourselves and our ability as educators. Sorry, excuse me.
No, Davida, please don't apologize. I appreciate, and I think we all do, the passion with which you speak and the impact that this has, that these dollars had on educators and on children is so important, and on communities, right? I mean, I think that I really just appreciate your perspective and what you're sharing here with us. Yeah, Anthony.
Yeah, I just wanted to add that often when the pandemic was kind of coming to an end, even though it's not officially over, we always get to ask, what's one thing that happened during the pandemic that meant something to you? And what I always answered that question with was, for those first 2 weeks, like March, when the pandemic first hit and everybody was staying at home and looking crazy and kids driving you crazy, that's what a lot of communities of color and minority communities, that's how they feel 365, 24/7. And so I thought executive directors got to feel what that felt like. And that gave them new empathy and a new way of looking at things. So I think that was one of the important things, besides what we're talking about, that they got that, to look through that lens of a lot of minority communities.
Thanks, Anthony. I appreciate you sharing that here as well. I think it's so poignant. So I appreciate it. And I think that this is a really good opportunity for us to talk about what we need to start thinking about how we can take what we've learned from these temporary investments and make the case for stronger permanent investments, right? As you're talking about, Davida, you shared you are able to offer the summer program last summer, but not this past summer, or 2 summers ago, and not this past summer, because the funds were exhausted, right? So what are the lessons and what do we need to be doing to take what we've learned from these temporary investments, make the case for stronger permanent investments to continue this push forward that we've seen? And Aisha, I'm gonna start with you. From your perspective, what makes cash specifically an important tool for economic security as opposed to in-kind benefits? Are there lessons you've learned from working with Magnolia Mothers Trust that we could use to be helpful as we move towards a child allowance?
I think it's lessons that we've all had the benefit of learning in the last year about the benefits of cash. And I think Anthony and Davida have said it here perfectly, is agency. It's having the ability to make the determination for what it is that you and your family needs. Point blank, period. That's better than any voucher. That's better than any subsidy. It's allowing you the freedom to decide for yourself. And that's what you don't receive with vouchers and other benefits. And so when we really talk about the beauty of cash, cash takes away this ideal of deservedness that we love to tell ourselves is a reality within this country, that certain people are allowed to have the American dream. Certain people are allowed to dream and have joy and be happy. With cash, is all people are deserving of that simply by the fact that you are actually living and you're breathing and you're here. And so that's what cash does. And when we talk about how do we get to permanency, when we implemented the child tax credit last year, it wasn't with the idea that it would be gone in 6 months. So all of those of us who are advocates were working towards permanency. And we were doing everything that we could in order to ensure that we provided the data, we provided the narrative, and we provided the community will in order to get to permanency. So when we talk about what is it that we can do differently or what needs to be done better, the only thing that we can do different or better is rewrite how our democracy works and rewrite how we actually allow power to be held by one individual within our Senate. And so those are pieces that I think are important conversations that we should be having, because when we say, oh, what should we have done differently, it makes it seem as if we as a community and as a collective are responsible for the failure. And we're not. We did our part. For 6 months, you could not turn on a TV or read a newspaper or listen to a podcast without hearing about the benefit of the child tax credit and the benefit of the child tax credit across a plethora of voices. There were families that were middle income, low income, brown, Black, white, working, not working, all of that, talking about how their lives had been changed in big ways or relatively small ways, how they could save for their future or how they could pay their bills. All of those collective narratives we had. And so the fact that we didn't get to permanency, that was held up by one individual. So there's nothing that we could have done any better. There was nothing that we could do differently in that moment. Now, what it is that we can do when we're talking about the long arc of this work is that we can make sure that we are building power at the ground up, from the ground down to the ground up. So all of those voices that we mobilize and sharing their stories as it relates to the child tax credit, we have to make sure that we keep our hands on them. What are we doing with those families now? How are we engaging Davida and Anthony and others like them that not only benefited from it, but are now leaders within this space? It's important that they tell their story in the real moment, but it's also important that we make sure that they are trained in advocacy and movement building, because we have got to begin to shift democracy within this country if we are going to get to long-term systems and policies that benefit all of us permanently, not just for 6 months. And then we say, oh, that was a fun experiment. Let's get back to business as usual. Business as usual is not fun for the majority of us. The status quo has enough friends. So we need to quit being friends with the status quo. It does not need us.
Speaking truth to power there. I mean, I'm sort of at a loss for words, because I feel like I just need to go and dig into the work right now. I'm like, all right, talk to you all later. Let's go do this, right? Let's start to shift, right? What can I do to help? So I appreciate everything you've said. And, as we think about moving forward and as we think about making this permanent, and the messages that we're lifting up and the messages that we're sharing and the power building that we're doing and the support that we're providing to communities and watching and letting communities and parents lead this work. You know, Anthony, is there anything that you want to share in terms of what this needs to look like in the future? Frequency, amount, how do we do outreach to communities?
I would say one thing that needs to be done is you have to stop pulling out the rugs from minority communities, minority parents. 6 months was just a very minute space and time as far as what has gone on in this country, and to actually give something and just cut it off after 6 months. It was just, to me, that was cruel and unusual punishment, to be honest. Lawmakers have to understand, like, it's just a country for the few, but a country of a whole. And we have to take that outlook with these programs. It was just astounding. I just didn't think no way that it was going to end that quickly. Because like I said, a lot of the minority fathers whom I work with and advocate for, they were just getting their feet under them. And it was just starting to make like a real difference, not just a difference for a moment, but it was turning into a movement of difference. And to have it cut off that quickly, I think it's just astonishing me in this country that our government would do that just that quickly. And when they have, like the doctor said, all that data and everything that shows that how it was being used and what it was for to find in these communities of color and minority households, it's just astounding. Well,
and when I was thinking cruel, and then you said cruel. So, I mean, I think that's a strong word to describe this impact, right? Both you and Davida talked about how this CTC, what that meant for security for both you all and your communities. And it's this fake security, right? We gave it to you, we took it away, right? And you were able, Anthony, you talked about some of the other fathers that you work with, just starting able to really get their feet under them, and then it's gone. And, you know, I think both of you talked about really the frequency of having this as a monthly. Ellie talked about the frequency of having this monthly as, you know, you could expect it, you could use it in budgets, and that was really important. Not just sort of a one-time thing, right? But really being able to include that in your budget throughout the year is important. On the childcare front, right? Amy, interested in learning about sort of, based on how North Carolina rolled this out, lessons learned as a stakeholder on what states need from the federal government when it comes to childcare investments.
Sure. Yes, I think one thing that I could build off of what Aisha and Anthony just shared is the federal government needs to know, and others need to know, we've got the research, we've done the experiments, and we know what works. And these are programs that work. The child tax credit, infusion in early care and education. And if we can't get a Build Back Better, fund those programs that work. Fund Head Start fully. Go after that additional $1 billion right now in this budget year. Fund Child Care Development Block Grant. Fund the child tax credit. These work. Don't go saying, oh, you early childhood folks, Amy, you are so confusing. Your system is so complex. We don't understand it. We don't really know what works. Yes, in fact, we do. We'll provide you the data, the brilliant researchers. So no disrespect to those of you at CSSP doing a very important research, but we've got it now. Come on, fund it. We're not gonna play games here. And you are literally playing games with children's lives. We know the connection. The research is stronger than any research in the age range for early childhood in that birth prenatal to 3. And that is a direct connection to child fatality rates, infant mortality. And so this is very, very serious stuff. So I think that message needs to be sent back to the federal government. The flexibility that came with the dollars was appreciated and respected at the state level. Appreciated because it did give a nod toward, we believe that you do know best. And when you go to state, we would say at the state level, at the North Carolina Partnership for Children, go smaller. You need to go smaller and go to community. And when you've gone to the community and found out what they need, go to the neighborhoods. go to zip codes, go to census tract and look and make sure that you are really providing. And then you are especially looking at who has been left out, who has been historically under-resourced, continuing to be under-resourced, and make sure that those folks are getting served by these, again, evidence-based, evidence-informed, well-researched programs. We were so fortunate to have great partners in the Department of Health and Human Services, the Division of Child Development and Early Education in North Carolina, the Child Care Resource and Referral System, and to have a very wise North Carolina General Assembly that says, we believe the infrastructure matters, that this system of Smart Start in fact deserves to be funded, because then when we have a crisis, we can get the dollars out quickly. When the feds get those dollars to us, we'll send them out. And so we're pleased to have great partnerships, great collaboration at the state level. And that's important. Another thing I'll just mention, then be quiet, is we created a model salary scale with higher ed folks and DHHS and Child Care Resource and Referral and others. And we could then use that in ensuring the dollars went for compensation that provided living wage. Thanks.
That's great. Thank you, Amy. And thank you for that last example, a really good sort of concrete, tangible thing that folks can take back as well. I have one more question, Davida, for you, and then I'm going to turn to questions from the audience. So again, would invite the audience to put some questions in the Q&A if you haven't already. I see a couple have popped in, but before we go to questions from the audience, Davida, I'm going to ask you my favorite question, which is sort of a magic wand question, which is, how could, if you had a magic wand, how could bigger, more sustainable investments help parents of young children and also make a difference in the work in early education that you do?
I feel like pouring funds into families that meet that under compensated level, it would help mostly with household necessities like bills, rent, more car notes, insurance, different medical care, because those things are definitely taken for granted. Most people think that there's something that everybody have, and they're not. They're not. And on a more I believe you asked like the school-wide part,
Yeah.
with teaching, it would give teachers more of a we will feel more appreciated. Being underpaid and still doing our job speaks highly of why we do it. We love doing it, so we do it. This is our passion. But to feel appreciated and paid through, but to feel appreciated through being compensated properly would just give us a higher, will make us more prone to being in an environment and providing the environment for children that it's already a safe place, but it would be a funner place. It'll be a place where not only are the children always happy and taken care of, but we are too. Sometimes we get that burnout, and it's because we have to be here and there after we've done all this, but we don't have enough money, so we have to be here and there. But being properly compensated would definitely help us be more into our career and being able to be into our career, because we don't have to exhaust our time into other places so that our needs are met.
Absolutely. Absolutely. I really appreciate that. So we've got a couple questions beginning to come in. So we've got a couple questions that I'm going to try and fire off quickly in the last couple minutes. Aisha, first question is, from your perspective, how do we garner? You talked about this shifting power building movement. How do we continue and how do we do this? How do we garner support publicly to establish a guaranteed income for children? And subpart to that, sort of a tiny sub question is, Any updates or your thoughts or reflections on the CTC in Congress this year?
So the first part, how do we go about making sure that we are banging the drums on the importance of this? Is really, community-based organizations mobilizing their base and making sure that this topic and this conversation stays front and center. And that not only does it stay front and center, that we really help families connect the dots between the CTC and their day-to-day lives, which is what I think we did so beautifully last year when families had an opportunity to apply. So I think we have to continue to do that, even though it is rolled away. We need to be making sure that we're advocating for the EITC, and then also talking about the CTC and building that power at the bottom. And as it relates to where the CTC currently is in Congress, there's very slim likelihood that it will actually happen within the next session. But individuals are still lobbying for it. We are still collecting data around it. We're still talking about it. I think the data that came out last month showing that how we were able to cut child poverty in half in 6 months helps to go a long way, and really continuing to build the case for why it is that we need to make this legislation permanent.
Thank you. And Amy, there's a question about the rollout related to the child care funding in North Carolina, saying it seems like you all did it pretty well in getting that child care funding out in North Carolina, and any takeaways that you could share with other states that they could use or build on in their own states.
Sure. I would just circle back to my comment that I didn't probably articulate as well as I should, but I think that having state systems that are well-funded, the infrastructure is there, the setup that allows for state to community collaboration. It's that state to local connection. So the federal dollars came in to the Department of Health and Human Services, and with a partnership with the General Assembly, they were able to give some direction and guidance and then get it out through the system of Smart Start, as well as the child care resource and referral system in North Carolina that have strong county level connections. Made all the difference. We also were fortunate to already have this model salary scale in place, strategically done to be ready for something like this, and could offer that to providers so that they had guidance on how to use those dollars for compensation and benefits. They also at DHHS set up a hotline and had it well staffed, so that was critically important as well. And then really pushed all of us to say, 100% go for it. Make sure that every provider knows about this and is availed of this opportunity. So that, I think those things were some of the most important.
Thanks, Amy. And then the last question, selfishly, I'm going to take as my own question. I think as the facilitator, I get to do that, right? And it's Anthony and Davida. If you all had one or two things you wanted to say to policymakers about why this matters, what would that be?
I would double back with what Ms. Cubby shared. Our future depends on it. Our children are literally our future, and who takes care of our children? Our educators, their parents. So by doing this, you're doing not only a justice, not only are you undoing an injustice, but you're doing a justice to educators, parents, and children. And by doing so, it's helping our community, it's helping our nation be better prepared for the future.
Thanks, Davida. Anthony?
And along with what Davida said, I would say stop giving us a sliver of a sliver of a sliver and then telling us, okay, you got your part. We checked that box. Now get in the back of the line.
Powerful. I hope folks heard those messages and really can go and take those with you and as you do your own work. I want to thank everybody for joining us today. I want to thank our amazing panelists, Amy, Ellie, Anthony, Davida, Aisha. Thank you so much for sharing your experience, your perspective, your lives with us today as we talk about these really important investments. I want to, again, just as we wrap up, folks can learn more about all of this through the briefs. All of their work is captured in the briefs as well as on their own websites and CSSP. So would encourage folks, go there, check it out. And if you have any questions, follow up, please reach out to us at CSSP. We're happy to help you answer those and help connect you to the other panelists here as well. So thanks again, everybody, for joining today. And I hope everyone has a wonderful rest of your afternoon. Thank you, panelists. And I'll give you all a round of applause.
Thanks, everyone.
Thanks, everyone.
Bye-bye.
Bye.